How do you feel when you have a joint pain? Have you or your family members ever had a joint pain in the morning? Have you experienced joint pain in the fingers and toes? My mom is currently suffering from the rheumatoid arthritis early this year. At first, she experienced pain in her leg, such as a swollen feet, and as time went on, it got worse, and her hands were also affected and swollen. When she arrived at the hospital, it was confirmed that she was suffering from the rheumatoid arthritis caused by a weak nerve. Ladies and gentlemen, I have chosen this topic and done research on this disease. And what shocked me was that there were stories that end happily, but so many do not. This is because there are many people don't know about this disease. Ladies and gentlemen, I'm standing here because I would like to encourage you to know how can rheumatoid arthritis can be treated. This is because there are still many who do not know about it and are not aware if they suffer from this disease in this stage. For the first, let me introduce you what is the rheumatoid arthritis is. This is because the most of us doesn't know what is the meaning of the rheumatoid arthritis. Rheumatoid arthritis or RA is an autoimmune disease that can cause a joint pain and damage throughout your body. The joint damage that RA causes usually happens on the both sides of the body. So, if a joint is affected in the one of your arms or legs, the same joint in the another arms or legs will probably be affected too. This is one way that doctors distinguish rheumatoid arthritis from the another forms of arthritis, such as the osteoarthritis or RA. Treatments work best with the rheumatoid arthritis is a diagnosis early, so it's important to learn the sign. Read on the learn everything you want to know about the RA, from the types and symptoms to home remedies, diets, or another treatments. After knowing about the rheumatoid arthritis, here I will tell you about the symptoms that encounter to detect the disease. RA or the rheumatoid arthritis is a chronic disease marked by the symptoms of inflammation pain in the joint. These symptoms and signs occur during periods known as the flare or the exacerbations. Other times are known as a period of remission. This is when symptoms disappear completely. While RA or rheumatoid arthritis symptoms can affect several organs in the body. The joint symptoms of the RA include the joint pain, joint swelling, joint stiffness, loss of a joint function, and the tendonitis. Symptoms can vary from mild to severe. It's important to not ignore your symptoms, even if they come and go. Knowing the early sign of the rheumatoid arthritis will help you and your healthcare provide the better treats. Next, I will tell you what is the rheumatoid arthritis cause. The exact cause of the rheumatoid arthritis isn't known. However, certain of the factors seems to play a role in increasing the risk of developing RA or triggering its onset. Factors that may increase your risk of the RA include being a woman, having a family with the RA history. Next is the factor that may trigger onset of the RA involved. First, exposure to the certain types of bacteria, such as those associated with the potential disease. Second, having a historical of the viral infections, such as the Epstein-Barr virus, which cause the mononuclear cysts. Third, trauma or injury, such as the broke, damaged bone or fracture, dislocations of the joint and ligament damage. Next is the smoking and having obesity. The cause may not be known, but there are several risks and triggers. Next is the rheumatoid arthritis treatment. There is no cure for the rheumatoid arthritis, but there are treatments that can help you to manage it. Rheumatoid arthritis or RA can keep both patients and the physicians on their toes as they figure out the best way to treat the symptoms and slow the progressions of the conditions. Recently, advances in the treatment of the strategy have resulted in ever improving outcomes and the quality of life for those with the rheumatoid arthritis. Treat to target rheumatoid arthritis is a treatment philosophy that rheumatologists use to effectively manage this disease. Treatments of the rheumatoid arthritis help to manage the pain and control the inflammatory response, which can in many cases result in the remissions. Decreasing the inflammations can also help to prevent further joint and organ damage. Treatments that may include is the medications, alternative and the home remedies. Third is the dietary change. And fourth, specific types of exercise. Your healthcare provider will not work with you to determine the best treatment plan for your medical needs. For many people, these treatments help them live an active life and reduce the risk of the long-term complications. Here, I will like to tell you about the rheumatoid arthritis diet. Your healthcare provider of the additions may recommend an anti-inflammatory diet to help with your symptoms. This type of the diet includes foods that have lots of omega-3 fatty acids. Food high in omega-3 fatty acids include fatty fish like salmon, tuna, herring and mackerel, chia seeds, flax seeds, and walnuts. Next is the antioxidants such as vitamin A, C, and E, and the selenium may also help reduce inflammations. Food high in the antioxidants include the berries such as the blueberries, cranberries, goji berries, and the strawberries. Dark chocolate, spinach, kidney beans, pecans, and the artichokes. Eating all lots of fiber is also important. According to some research, fiber may help reduce inflammatory response, which may decrease C-reactive proteins level. Choose whole grain foods, fresh vegetables, and the fresh fruits. Strawberries may be particularly beneficial. Foods containing flavonoids can also help the counter inflammation in the body. They include the soy products such as tofu and miso, berries, green tea, broccoli, and grapes. Why you don't eat is just important as what you do eat. Make sure to avoid trigger foods. These include processed carbohydrate and the saturated or the trans fats. Avoiding trigger foods and choosing the right foods in trying to follow an anti-inflammatory diet may help you to manage your rheumatoid arthritis. Next is the home remedies for the rheumatoid arthritis. Certain home remedies and lifestyle adjustments may help to improve your quality of life when living with the rheumatoid arthritis. These include exercise, rest, and the assistive device. First is exercise. Low impact exercise can help to improve the range of the motions in your joints and increase your mobility. Exercise can also strengthen muscles, which can help to relieve some of the pressure of your joints. You may also want to try gentle yoga, which can help you to regain strength and flexibility. Second is get enough rest. You may need more rest during flare-ups and less during remissions. Getting enough sleep will help you to reduce inflammation and pain as well as fatigue. Third is to apply hot and cool. Ice pack or the cold compress can help to reduce inflammations and pain. They may also be effective against muscle spasms. You can alternate cold with hot treatments such as a warm shower and a hot compressor. This may help to reduce stiffness. And last, try assistive device. Certain devices such as splinters and braces can hold your joints in the resting positions. This may help to reduce inflammations. Canes and the crutches can help you mentally mobility even during the flare. You can also install a household device such as a grab bar and a handrails in bathroom and along a staircase. Shop home medis is the ice packs, canes, grab bar, handrails, and the end sides.